How many Indian uncles have to suffer before we realize that acidity is often a heart attack in disguise? Brushing off that chest pain as just gas is killing us. Here's the truth. South Asians have some of the highest rates of premature heart disease in the world. So why does this happen? First, we store fat differently. We build visceral fat, which is fat around the organs, and that can be present even if someone looks skinny. Second, we have a very high predisposition to insulin resistance, even without obesity. This means more systemic inflammation and earlier damage to our blood vessels. Third, our dietary patterns. Spices are not the problem. Spices are great. The problem is refined carbs, jalebi, pakora. Those huge glucose spikes over time add up. But there's one more piece that no one really talks about. It's our cultural avoidance of strength training. A lot of us grew up hearing, weight training will stunt your growth, or you don't need that, just walk, walking's enough. That mindset cost us. When you avoid building muscle your entire life, you lose muscle faster as you age. Lower muscle mass means worse glucose control, higher insulin resistance, and a much higher risk of early heart disease. And later in life, it destroys functional capacity. Getting off the floor, carrying the groceries, climbing the stairs, all these get so much harder decades earlier. When you put all this together, it starts to make sense why South Asians get heart disease 10 to 15 years earlier than the general population. So if you're South Asian, change your habits early and take your symptoms seriously. Build muscle, cut down refined carbs and oily snacks, increase your protein intake, stay active. Small, consistent habits now can prevent the heart attacks we see way too early in our community. Save this and send it to your family WhatsApp group. This is how we break the cycle.